According to Worldometer's real-time statistics, as of around 6:30 on November 19, a total of 11,873,863 confirmed cases of COVID-19 pneumonia, and a total of 256,262 deaths in the United States. Compared with the data at 6:30 the previous day, there were 163,571 new confirmed cases, and 1,807 new deaths in the United States. Facing the worsening of the epidemic, CNN chief medical correspondent Sanjay Gupta sighed. The epidemic has caused nearly 250,000 deaths in the United States, which is equivalent to 625 passenger planes crashed in the United States this year, and almost 2 of them dropped every day. The U.S. epidemic has experienced 3 major fluctuations since March this year, especially since October that the epidemic has worsened, and the number of cases surged in mid-November, forming a third wave of peaks. Anthony Fauci, a top U.S. infectious disease expert, was very worried about the worsening of the U.S. epidemic, and issued warnings many times, but to no avail. In recent days, Fauci once again severely warned that as winter approaches, the United States is facing a very challenging and ominous situation. But Fauci's latest warning, as before, did not attract the attention of the U.S. authorities. So far, the epidemic has caused countless avoidable illnesses and deaths. On November 17, local time, the 87-year-old Grassley, the Speaker of the U.S. Senate, announced that he had tested positive for the COVID-19. The U.S. Newsweek stated that, unlike the spring epidemic, the new wave of epidemics targeted the rural population in the United States. According to data from the U.S. Centers for Disease Control and Prevention, in early November, the number of people who died of COVID-19 pneumonia in rural areas in the United States was 2.5 times that in cities. In March, the number in rural areas was less than 1/8 of that in cities. Charles DiMaggio, an injury epidemiologist at New York University, points out that the surge in infections in rural areas is a potentially catastrophic scenario. There are fewer hospitals and intensive care beds in these areas, and their coping capabilities are quite limited. Therefore, compared with cities, the damage caused by the COVID-19 pneumonia epidemic to American villages may be incalculable. WHO Director General Tedros said at a press conference on November 16, "Now we are very worried about the surge in cases in some countries. Especially in Europe and the Americas, health workers and health systems are being pushed to the brink of collapse." Compared with the United States, China's anti-epidemic effectiveness has been praised by the international community. The National Broadcasting Corporation recently quoted Ali Muqdad, a global health expert at the University of Washington, who said that China has done a very good job in controlling the epidemic. China has adopted strict epidemic prevention measures, and the Chinese public generally participates in and abides by the epidemic prevention guidelines. More importantly, China's social system plays a key role, which is not available in many countries in the world. If the United States wants to get out of the predicament of the epidemic, perhaps it is best to learn from China's experience to reverse the situation and minimize the number of deaths from COVID-19 pneumonia.